So my name is Nonkululeko Bhoikutso, and I'm the CEO of the hospital. The reason why I chose to work in a children's hospital because I've always wanted to work with sick children all my life, and it's been a dream of mine to be part of a children's hospital because of my own personal experience with healthcare as a child, and that's really what pushed me to come and work here. So when we first came into contact with the 1cc Foundation, I think this was probably pre-COVID, many years ago, and the idea was brought into the hospital. We knew that this was a partnership really made in heaven because, number one, of the values that we share, but most importantly because we knew the importance of having an emergency service located at the hospital. Our hospital provides care for both public patients and private patients, and what we've seen with public patients, they come from all around the country, Limpopo, Northwest Province, Mpumalanga. And so often just to transport the children to the hospital can be very difficult. It takes a very long time to come to the hospital. But also once they're discharged, some patients would stay for 4 days just waiting for transport to take them back home, which makes it very difficult for the parents, because then they have to travel up and down every day or every second day. And so for us, this partnership showed us that, number one, we'll be able to get the kids back home or back to their base hospital quicker. And number two, we'll be able to have a system where the doctors are able to monitor the patients as they come in to see what's the condition of the patient. Should you transfer this patient? Is it safe to do so? And so really the partnership with 1cc for us was a meeting of minds, a meeting of values, and just to be able to provide good quality care to children. So the Nelson Mandela Children's Hospital is a specialized pediatric hospital, meaning we see very complex cases. So when we transfer children, it's not like a normal ambulance. It's actually advanced life support that we require. And so the 1cc Foundation is equipped with the right people who have the correct skills to be able to deal with the type of patients that we see, and also the equipment itself and the infrastructure. As you know, that to treat children is not just about the hands of the doctors or the skills, but you need the equipment. And so the 1cc ambulance has the type of equipment that will help us to take care of a baby who is very sick, who is in transit. And the advanced paramedics that are with 1cc are able to also assess the patients before they come in. In fact, we've seen cases where they've assessed the patient at base and realized that this patient is actually not safe for transfer. And in that way, we're ensuring that we're providing the best care for children. We're transporting the right kinds of children, and during transport, that it is safe for our patients to be transported. So in South Africa, we have a lot of disparities in our population. You've got some very poor individuals, and most of our population, in fact, that we serve, 80%, or just over 80%, do not have access to medical aids, meaning that they have to use a public service to receive their care. And so the Nelson Mandela Children's Hospital provides care to both public patients and private patients. And we're ensuring that our existence tries to bridge the gap between these disparities that exist in our society. And so with the 1cc Foundation, who have the same ethos and values with us, are ensuring that we provide care to these 80% of public patients that wouldn't be able to access private health care. So medicine and the advancements in healthcare have helped us to make sure that we improve our clinical outcomes in this hospital and generally in the medical industry. And as we've seen with the 1cc Foundation, they have a system called telepresence in the ambulance where our doctors can see exactly what's happening during the transportation of patients. And this assists us to be able, for the doctors to be able to give advice to the paramedics as they transfer, to be able just to talk. And so the idea of telepresence and telemedicine is really the future of medicine, because the doctors are so few, the numbers are so few of healthcare providers. So we have to rely on technology, leverage on technology to enable us to provide the care that is required beyond the borders of the hospital. So as we always say at Nelson Mandela, children are our future. They are present, but they're also our future. And it's important for us to collaborate. This is not about one hospital doing everything for all children. And so collaborations are what we believe in as an organization. In fact, collaboration is one of the core values of the organization. So to all other organizations that are working with children, we are doing important work for our country, for our children, for our future. And it's important for us to realize that we can't exist as islands, but our collaboration will increase and our efforts in providing care to children.